Good morning, everyone, and welcome to our second National Hospital Price Transparency Path to Affordability Conference, hosted by the Employers Forum of Indiana. My name is Christan Royer, and I am board chair of the forum, as well as director of benefits at Indiana University. Gloria Sachdev, president and CEO of the forum, and I are honored to be your hosts today. While we would love to be with you in person, we are so grateful for the opportunity to hold the conference virtually. Initially, when we had to change to this virtual format, we hoped for maybe 300 attendees, but we're excited to share that we have over 550 participants from all over the country joining our conference today. Thank you for taking time to join us. Before we get started, I'd really like to say thank you to all of those who have sponsored the conference. A special thanks goes to the National Institute for Healthcare Reform and to Arnold Ventures for providing grant funding to the forum. Because of their support, we're able to bring you this conference and offer free registration to all attendees. In addition, we would like to thank our conference sponsors who also support price transparency. The Alliance, Apostrophe, Carum Health, Gregory and Appel, Healthcare Blue Book, Quantros, and Quantum Health. Since we are unable to be together in person today, we are excited to offer a unique online virtual exhibit hall booth for each sponsor. We encourage you to visit the exhibit hall to see what each sponsor offers. We're going to post a link over in the chat box so you can visit them throughout the conference when we have breaks today. Without the collective support of our sponsors and funders, this conference would not be possible. Again, a big thank you to all of them. So I'd like to talk a little bit about our agenda today and get us started. We have an absolutely packed agenda, and so I want to try and keep us on time today. Some of the presentations that you're going to hear today are pre-recorded and some will be live. Pre-recording was offered as an option to a few of the speakers. Many of our colleagues are on the West Coast, and we wanted to avert any potential technical issues, especially for those who are living in areas where there are wildfires raging. Regardless if it's live or a recorded session, we encourage you to actively participate in the conference by placing your questions in the chat box throughout each presentation. Even if the session has been pre-recorded, the presenters are still with us behind the scenes, and they are going to be working to reply to your questions in the chat box in real time during their presentation, and some of the presenters will join us after their presentation and take questions as well. Please note that any questions that you put in the chat box will only be seen by the conference speakers and moderators. And just so you know, also, we have a conference brochure available for you to peruse. That's posted on our website, and we're going to post a link to that in the chat box. You can download that. It also contains our agenda throughout the day, as well as full speaker bios for everyone who's presenting today. Be sure to download and check that out. To start us off today, we are excited to welcome our keynote presenter, Senator Mike Braun, and he will have a Q&A session with Gloria Sachdev. Following that, the long-awaited results of RAND 3.0 will be shared by Dr. Chris Whaley, policy researcher at the RAND Corporation. After a short break, Shane Wolverton, Senior Vice President at Quantros, is going to discuss hospital quality variability. Next, we want to highlight what's been happening in Indiana at the policy level as it relates to healthcare prices. Our speakers are Indiana State Representative Donna Shibley, Al Hubbard, and Brian Blaze, who will all discuss the important legislative topics considered in 2020. Just before lunch, we would like to recognize a couple of individuals for their outstanding contributions to healthcare price transparency and leadership. This is a new agenda item for us this year, and we're excited to add it to our conference. After that, upon returning from lunch break, we won't be able to have the Q&A session as originally planned with Mark Cuban. Unfortunately, his schedule for Shark Tank filming changed at the last minute, but we are still going to hear from our provider executive panel as well as our employer panel. Both of those sessions will be moderated live, and we will have the opportunity to hear from both providers as well as employers and get the reaction from the RAND study results from the morning, as well as their overall thoughts on healthcare price transparency and quality topics. So now that we've kind of gone over some of the housekeeping items for today and the agenda, without any further ado, it's my pleasure to introduce to you Gloria Sachdev, President and CEO of the Forum, to provide a few opening remarks.
Thank you, Kristen, and welcome everyone. While we wish we could be with you in person, we are thrilled to still have this opportunity to discuss the important issue of price transparency and steps towards healthcare affordability. I will keep my remarks brief as we have an outstanding agenda for you today. It might be helpful to provide some context when we look at where employers are spending their money. About 35% of the cost pie is to hospitals, with another 25% to physicians. In Indiana, large health systems now own more than 80% of physician practices. So this is why we started down the path of how to fairly compare hospital prices and benchmark ourselves against other states. Some have wondered, why did we not initially focus on high prescription drug costs, especially since I'm a pharmacist by background and training. The reason is that prescription medications only represent 9% of the employer healthcare cost pie. So while it's the fastest growing slice, and I fully plan to address this in the coming year, hospital services deserve our full attention. Our aim is to align payment with value. So we wish to identify the best quality at the best cost. Cost is simply price times quantity. We know from years of published research from highly esteemed health policy researchers, including Drs. Chapin White, Chris Whaley, Uwe Reinhardt, Michael Chernow, and others, that healthcare costs continue to rise year over year because of the price of healthcare, not the quantity of healthcare that's being used, commonly referred to as utilization. In an effort to better understand this locally, we commissioned the first hospital price transparency study, which we affectionately call RAND 1.0 for short, and this was published in 2017. Here, we aim to analyze hospital prices relative to what Medicare would have paid. The results were shocking for employers, hospitals, and really everybody. But what was somewhat challenging to make sense of when hospital leadership noted that all hospitals across the US cost shift to employers. So we decided to invite other states to participate in the next round of this study to benchmark ourselves. I ran around the country and invited employers to participate. Many thanks to the National Alliance of Healthcare Purchasers Coalition and state business coalition leaders across the country for engaging their employers. The second study, RAND 2.0, was published last year and includes 1,600 hospitals in 25 states. Surprisingly, Indiana was found to be the highest priced state, and that caused employers and other stakeholders to really think about how we need to purchase healthcare differently, and we'll hear more about that during this session. The forum aimed to continue the price transparency conversation, and I'm happy to share with you that for RAND 3.0, we have over 3,000 hospitals in 49 states plus DC. You will hear all about the results of this study shortly. RAND 3.0 final data was just completed 3 days ago. So it seems some folks across the country have a draft version, and I encourage everyone to download the final version from the employerptp.org, so that's employer, P as in price, transparencyproject.org, or the RAND website.